Yeah, well, this is a rapidly evolving situation, and as you know, in the last few days we've had more than 60,000 people returning from Saudi Arabia, and it really would be a struggle for any government to cope with this large numbers in a matter of days. And indeed, we're now expecting that there could be as much as 30 or 40,000 additional people arriving within the next week. In the last few days, the numbers have been around 7,000 per 24-hour period. So it's a massive effort led by the government of Ethiopia to really respond to what is now a humanitarian crisis, to actually meet the needs of these people, and not only meet their basic needs, but ensure that there's a minimum level of dignity for these people as they're arriving home, some after many years working outside the country. So really UNICEF's role is to support the other UN agencies involved in this effort, IOM, UNHCR, and other agencies involved, of course ultimately supporting the government of Ethiopia. So in concrete terms, we're looking at obviously particularly issues around the most vulnerable women and children, supporting unaccompanied children particularly, through the Ministry of Women, Youth and Children, to help them reunify with their families, to help them in transportation to reach those families, to help the most vulnerable women who may not want to go back to their families for various reasons, and to find alternative options for those women. Also very concretely in health, we're supporting the government to be able to establish a health clinic in every transit centre. There's already 7 transit centres established. We're supporting the government also in water and sanitation, because you can imagine there's thousands of people now in these transit centres, and we want to make sure that the water and sanitation capacity keeps up with the number of people, so there's no risk of diarrhea disease outbreaks. Now more than 100 unaccompanied children already have arrived in Ethiopia, and you know, for UNICEF these are really our critical group, because these are the most vulnerable of all of the people that are arriving in Ethiopia, back home if you like. And for UNICEF the critical thing is first of all to identify where their family is. So do they have parents, do they have extended family, do they have other relatives, and to put them in contact and help reunite them with their family members wherever they are in the country. And we're mobilizing a range of partners. So our own UNICEF staff are volunteering, which is a great sign of solidarity from UNICEF staff itself. Next week we'll have between 10 and 20 UNICEF staff volunteering to assist with these children. We're mobilizing social workers, and indeed the social work students have also contacted and asked us to be involved in this support, and of course our traditional partners such as the Ethiopian Red Cross and civil society will be involved in the response as well.